Remove the sterile delivery set from the package and maintain in a field that ensures sterile fluid pathway at a minimum. Do not remove the needle sheaths from the two needles to help preserve needle sterility. The delivery set should be assembled in close proximity to the patient and placed on an elevated surface at the patient's side. Before assembling the delivery set, check that all luer lock connections on the delivery set lines are tight. Each line is identified by a color-coded tag with an associated letter to ensure correct placement in the delivery box. Firmly place the three-way stopcock into the bracket on the back wall of the delivery box so that line A is positioned upward, line B positioned downward, and line C positioned to the right of the stopcock. From inside the delivery box, insert lines A and B through the corresponding holes exiting the delivery box. The holes in the delivery box are color-coded and marked with A and B. Drape line C with the sheathed needle attached over the outside of the box so that it does not hinder the placement of the V-vial holder in the center of the delivery box. From inside the delivery box, insert line D through hole D in the delivery box and drape the sheathed needle end of line D over the outside of the box. Push the stopcock control knob in so that the cupped end firmly engages the three-way stopcock. When the stopcock control knob is fully engaged with the three-way stopcock, the movement is limited to 1/4 turn by the small safety bar on the outside shaft of the stopcock control knob. This requires the safety bar on the shaft of the stopcock control knob to be firmly seated in the limiting notch. Remove the caps from the ends of flushing line B and line D. Connect an additional three-way stopcock to line B. This will allow contrast and water syringes to both be connected to this line. Attach 20 milliliter syringes filled with water for injection to lines B and D on the outside of the delivery box. Note that there are one-way valves fitted to lines B and D to prevent any possibility of Sirspheres microspheres refluxing into either of the syringes. Prime all lines with water for injection. This is done with sheaths still on needles to maintain sterility. To enable flushing of line C, partially disengage the stopcock control knob to allow more than the limited 1/4 turn. Rotate the stopcock control knob 90 degrees counterclockwise to the 9 o'clock position past the normal limit to allow water to flow through the three-way stopcock into line C. This requires the safety bar on the shaft of the stopcock control knob to be just free of the limiting notch, while still being engaged enough to control the three-way stopcock handle. Re-engage the stopcock control knob fully so that it is limited to 1/4 turn. With the three-way stopcock control knob in the 12 o'clock position, prime line A. Now, prime line D. Place the V-vial holder that contains the V-vial with the Sirspheres microspheres into the retaining ring in the delivery box, and remove the plug from the top of the V-vial holder. Discard the plug in a designated waste container as it may be contaminated. Swab the V-vial septum and the sides of the hole in the top of the V-vial holder with an alcohol wipe. Discard the alcohol swab in a designated waste container as it may be contaminated. Now the needles can be inserted into the septum of the V-vial. Care must be taken when inserting needles not to contaminate them. If contamination occurs, discard the delivery set and start with a new one. Remove the cover from the C-line needle, labeled C. Insert the C-line needle through the center of the septum, aiming at the base of the V, being careful not to scrape the V-vial sidewalls until it penetrates approximately 10 millimeters below the surface of the water in the V-vial. Ensure the distance between any punctured holes in the V-vial is at least 2 millimeters. The microspheres that are delivered to the patient must be decanted from the top of the V-vial so the suspension remains dilute and does not obstruct the catheter. Remove the sheath from the D-line needle and insert the D-line needle through the septum on one side. Ensure that any punctured holes in the V-vial are at least 2 mm apart. Push the needle deep into the V-vial until the point of the needle rests at the base of the V. It is important that this needle goes to the bottom of the V-vial so that when water is injected, it will swirl the microspheres into a thin suspension. Place the lid onto the delivery box. The delivery set is now ready for administration of the Sirspheres microspheres. When the delivery set is fully assembled, injecting water in the recommended pulsing motion from the syringe on line D will cause the microspheres to swirl into a suspension, pass into line C, and then into line A that is connected to the patient.